My name is Vladimir Kramskiy, and I'm an interventional pain physician at the Hospital for Special Surgery. I see patients from all walks of life. I see patients ranging from professional athletes, everyday weekend warriors, to high school teachers, and even adolescents. Because of my background as a board-certified neurologist, as well as an interventional pain management physician, my particular interest is in treating conditions affecting the spine, as well as conditions affecting the nervous system. Specific types of neuropathies, as well as difficult to treat conditions such as complex regional pain syndrome. We use various types of minimally invasive interventional techniques to address patients' chronic pain. The use of X-ray guided, or otherwise known as fluoroscopically guided interventions, is meant to deliver our targeted interventions to precise areas in order to achieve maximal results. The advantage of these approaches is it allows us to specifically localize and target areas that are the culprit for a patient's pain. There are also ways for us to deliver diagnostic interventions, for example, facet injections or medial branch blocks that allow us to, again, precisely localize patient's pain and then develop a comprehensive treatment plan moving forward. Complex regional pain syndrome is a specific type of neurologic condition that typically occurs after a traumatic injury to the extremity. This condition can become disabling and can significantly impair patients' daily functioning and activities of daily living. And so we have to bring to bear all the tools at our disposal, including techniques such as neuromodulation via dorsal root ganglion stimulation to alleviate their pain. Chronic pain is particularly taxing on patients. It takes a significant toll in terms of their mental and emotional well-being, taking time away from their families and their loved ones, and also gradually restricting patients' activities of daily living, taking away their everyday enjoyments. One of the most gratifying things that I do as a physician is seeing my patients get back to the things that they have not been able to do for a long period of time. Seeing them getting back to playing with their kids, seeing them getting back to their favorite sport activities. And I find it's one of the most rewarding things that's part of my job.